Bone is a continuous structure. If a break or a crack occurs in a bone, that's what we call a bone fracture. And bone fracture are of various types and they have been categorized under various criteria, such as we have type of fracture on the basis of axis of force. Right here, I have a long bone which experiences a perpendicular force resulting in a fracture present on a transverse plane. So we call it a transverse fracture. Similarly, here's the spine, which experiences a longitudinal force which compresses this bone right here, leading to a fracture in the bone. So we call it the compression fracture, which is commonly seen in old age. Next is on the basis of orientation of break. If the break on the bone is present on the transverse plane, that's a transverse fracture. If the break is spirally coiled, then that's your spiral fracture. If the break is linear and it is parallel to the bone, then that's your linear fracture. But if the break is obliquely present, then that's your oblique fracture. Similarly, we have on the basis of position of bone ends. If the two bone ends are intact, that is, after the fracture, the fractured parts are intact or connected with one another and not displaced from their original position, then that's your non-displaced fracture. But if the two fractured parts they are displaced from their original position and no longer intact with one another, for example, this particular fractured part lies on this axis and this one lies on this axis, so they lie on different axes, that's your displaced fracture. Next up, we have on the basis of completance of break. So if the fracture is incomplete, then that's your incomplete fracture. But if the fracture is complete and is throughout the bone, then that's your complete fracture. Next is on the basis of penetration of skin. If the fractured part does not penetrate through the skin and the skin around the fractured part remains intact, then that's your simple or closed fracture. Closed because the fracture is closed within the body wall. But if the fractured part penetrates through the skin, tearing the skin, then that's your compound or open fracture because the fragmented part opens the skin. Then there are other types of fractures as well, such as comminuted fracture, where the fractured part is contains multiple fragments, so they take a longer time to heal. Similarly, there's your segmental fracture, where fracture at least two places take place such that a segment is created. Here, one, two, three segments of the bone has been created. That's your segmental fracture. Then there's your green stick fracture, where the fracture occurs only on one side and due to which the bone is able to bend easily due to the weakening of the bone by the fracture, and this is often seen in children. Next is avulsion fracture, where a small part of the bone connected to a ligament or a tendon gets pulled apart from the main body of the bone. That's your avulsion fracture. Next is impacted fracture, where the impact on the bone results in an indistinct fracture line. And here, the two fractured parts of the bone are intact with one another, or they do not displace from their original position. They are kind of lodged into one another. And finally, there's your torus or buccal fracture, which is also often seen in children, where a bulge on one side of the bone is created. Let's say a kid falls on an outstretched hand. By outstretched, I mean something like this, where the hand is completely stretched out, and the kid falls on his or her wrist. Then a stress is created on the bones of the forearm, that is your radius or ulna, and that stress gets collected on only one side of the bone, resulting in the bulging of that side of the bone, resulting in torus or buccal fracture. Here are some practice x-rays that I want you to solve. In the first x-ray, the fracture has occurred in the bone of the neck or the cervical bone. It has occurred due to a longitudinal force acting on it, leading to a compressive stress. So the type of fracture is your compression fracture. In the second x-ray, the fractured parts of the bone have penetrated out of the skin. So it's an open or a compound fracture. In the third X-ray, a small chunk of a bone attached to a ligament has separated off the main body of the bone itself. So it's your avulsion fracture. In this particular fracture, the fracture on the bone has occurred on only one side of the bone. So it's an incomplete fracture called a green stick fracture. Finally, you have a bone which is bulged on one side. It has occurred due to the accumulation of stress on that particular side of the bone, probably due to a fall on it, and it's called a buccal fracture, which commonly occurs in children.